going off now. 1 minute warning, everyone. That's 1 minute till we're getting underway.
Good afternoon, thanks for joining us again today. I'll start, as I usually do, with a run through of the up-to-date statistics. The total number of positive cases reported yesterday was 928, which is 6.6% of the total number of tests, and means the total overall number of confirmed cases is now 186,720. 283 of the new cases were in Greater Glasgow and Clyde, 169 in Lanarkshire and 121 in Lothian, and the remaining cases were across another 9 health board areas. 1,672 people are currently in hospital, which is 38 fewer than yesterday. I'll give you just a little bit of context to that figure. It has fallen by more than 280 over the past week, which is very positive, though it is still significantly above the peak that we saw last spring. And I can also report that 108 people are in intensive care, which is the same number as yesterday. 5 additional deaths, I'm sorry to say, have been registered in the past 24 hours of patients who tested positive for the first time over the last 28 days. However, you will recall that the figures we report on a Monday are often low because registration offices are largely closed over the weekend. Since the last media update on Friday, we have recorded 60 new deaths, which means that the total number under the daily measurement is now 6,443. And yet again, I want to send my deepest condolences to everyone who has lost a loved one. I'm joined today by the Chief Nursing Officer. She will help me answer questions in a few moments. But first of all, I want to update you on a couple of issues. Firstly, let me give a progress report on the vaccination programme. As of 8:30 this morning, 866,823 people in Scotland have received the first dose of vaccine. That's an increase of 27,557 since yesterday, which is 3 times the number vaccinated last Sunday. In total, over the course of the weekend, approximately 80,000 people received the first dose. That's well over double the figure for last weekend. And of course, it includes a record total of more than 52,000 vaccinated on Saturday. In the past 7 days, more than 290,000 people have received their first dose, which is approximately 130,000 more than were vaccinated in the previous week. And over the course of this week, we expect to hit the milestone of 1 million vaccines administered. Within the headline figure, I can report that we have now vaccinated 99.6% of residents in older care homes, which I have to say is a scale of uptake that none of us really believed would be possible, and it is really important because that is giving protection to the group that we know is most at risk of becoming ill and dying from the virus. Now, you'll remember Of course, that we prioritised older care home residents and also frontline health and care staff for vaccination. So quite a few of them received their first dose during December. That means over the coming weeks, we will be starting to administer second doses to those groups of people. In addition, I can report today that more than 95% of over 80-year-olds living in the community have now had the first dose. Again, that's an uptake rate way beyond anything that we dared hope for just a few weeks ago. And almost 67% of 75 to 79-year-olds living in the community and 29% of 70 to 75-year-olds have also received the first dose, and we are on course to administer first doses to everyone in those age groups and to all people with significant clinical vulnerabilities by the target date of mid-February. We're also now accelerating vaccination for people aged 65 to 69. So this is all very positive news. The vaccination programme undoubtedly picked up pace considerably over the course of last week, as we always said that it would. And to see such large numbers, particularly in the groups most clinically vulnerable, now being vaccinated is extremely encouraging. I want to, as I have done before though, just add a couple of caveats to that. And in particular, let me remind anyone who has received the first dose of vaccine that you must remember that it doesn't start to have a protective effect until around 2 or 3 weeks after you have received it. And even then, we don't yet know that the vaccine will stop you from getting COVID or transmitting it to someone else, although there is growing evidence that vaccination does have some impact on transmission. But given that remaining uncertainty, it continues to be the case that everyone, including those who get the first dose of the vaccine, still need to be careful and to stick to the lockdown restrictions. Nevertheless, the pace of vaccination is very welcome good news. It will be one of the things that start to make a difference in the weeks to come. And I know from many of the messages I've been getting that it is providing comfort and relief, not just to those who are being vaccinated, but to their friends, family, neighbours and loved ones as well. So I am hugely grateful to everyone who is involved in the planning, distribution and delivery of the programme. And of course, I am particularly grateful to everyone who has come forward to be vaccinated in these early priority groups. As I've said already, the level of uptake is way beyond anything that we could have dared hope for just a few weeks ago, and that's a real tribute to the enthusiasm and the willingness of people across the country to be part of our collective efforts to beat this virus. Now, the second point I want to update on today is testing. On Friday, when he stood in for me here, the Deputy First Minister spoke about the expansion of targeted community testing in local authorities across the country. Today, I want to briefly highlight a programme which will make testing more easily available in the NHS Highland Health Board area, which in terms of landmass is the largest of our Health Board regions. In recent weeks, NHS Highland has been piloting a programme in Thurso and Lochgilphead. Fire stations in those communities have been used as bases where people can get tested, and that saves local residents from either having to wait for a home testing kit to arrive or having to wait until there's a mobile testing centre in their area, or alternatively from having to drive quite a distance to a permanent testing centre. So due to the success of these initial pilots, the decision has been taken now to expand that service, and I can say that from tomorrow, fire stations in Dunoon and Campbellton will be used as testing centres, and in the coming weeks a further 17 sites will open in rural locations across the NHS Highland area. That means that a total of 21 rural fire stations will be used as testing centres. Of course, these sites will be used in tandem with the larger testing centres for bigger communities across the Highlands, such as the regional drive-through site in Inverness, the walk-through sites in Wick, Inverness and Oban, and mobile testing units in more populous areas or areas which face a particular outbreak. These larger sites, of course, can carry out several hundred tests a day and are hugely important, but they often aren't needed or aren't accessible enough for smaller rural communities. For example, the two fire stations in Thurso and Lochgilphead averaged less than 10 tests a day each when they were piloting the new service. So in these circumstances, the fire station testing centres are a really valuable but also a proportionate way of making testing more easily available and accessible to our rural populations. They don't deliver large volumes, but they really help in ensuring that people can get easier access to testing when they need it. So I very much welcome the expansion of this pilot, and I want to take the opportunity to thank NHS Highland and of course the Scottish Fire and Rescue Service for making it possible. Those were the 2 points I wanted to highlight today. The progress we're making on vaccination is extremely welcome, and the continued expansion of testing is another way to help us keep the virus under control. But for the moment, while case numbers, although they are declining, still remain high, lockdown restrictions continue to be essential, and it is really important that all of us continue to abide with these restrictions. The most important rule right now for all of us remains clear: stay at home unless you need to be out of your home for essential purposes, for example, caring responsibilities, essential shopping, essential exercise, or work that genuinely can't be done at home. If you're meeting with other people outdoors, you should in fact only meet with one other person from another household outdoors, and that should be 2 people from no more than 2 households. Please work from home if you can. Employers, please allow your staff to work from home if that is possible, and when you are out, please remember the facts advice. Wear face coverings, avoid places that are busy, clean your hands and surfaces, use 2 metres distancing if you are talking to someone from another household, and self-isolate and book a test if you have symptoms. All of these things are working. We can see that in the numbers, and if we go back to the race analogy, while the vaccination programme is speeding up, it's really vital for all of us to be behaving in a way that slows the virus down, so that ultimately in this race we can beat the virus. So things are going well. They remain incredibly difficult and very precarious, but we do have that hope now of better times ahead. So please, for now, stick with it. Stay at home, protect the NHS, help us to save lives. Thank you very much for listening. I'm going to move now to questions, and the first question today comes from James Matthews from Sky.
Thanks very much indeed, First Minister. I would like, if I may, to ask a question that you will not be asked by the Harassment Committee next week, because it's not in their remit, but it is very much in the sphere of public interest. Did Scottish Government lawyers, in telling the Court of Session that the first you knew of complaints against Alex Salmond, mislead the Court? And did they mislead the Court on the basis of information that you provided?
This is a COVID briefing, but I'll briefly address that for this one time. No, that's not the case. I refute that absolutely. And I look forward to getting the opportunity at long last to appear before the Committee of Inquiry. I very much hope that will be next week, assuming they don't postpone it again. And let me be very clear, I am willing to answer all and any questions put to me by that committee, including on the topic that you have just asked me. And in addition to answering all and any questions, I perhaps will also get the opportunity to take head on some of the ridiculous suggestions that have been made about this whole situation, suggestions that I know have caused many people a great deal of distress. So that's all I'm going to say about it right now. I look forward to sitting before the committee, but this is a COVID briefing, and it's important that I do my job, which is to steer the country as safely as I can through this pandemic. So do you have a COVID question, James, before I move on?
Actually, I'd like you to, it's a question about integrity, First Minister, and integrity goes to the heart of everything you do, including COVID. Can I ask, when you say that you refute that, do you refute that you supply the information to the Scottish Government lawyers, or that they misled the Court?
I've said what I'm going to say today. I refute the allegation that has been made, and I, as is right and proper, will not address these serious issues in a press conference. I will do that sitting before the inquiry, as is my responsibility. I'll give you one more chance. Do you have a question on COVID, or will I move on to the next questioner?
Well, my question on COVID would be, by what month this year do you think you will have finished vaccinating everybody over 18?
We have said that we will, supplies permitting, vaccinate everybody on the JCVI priority list, which is everybody over 50 and those under 50 with underlying health conditions by early May, and then over the summer we will do everybody in the adult population. Exactly when that will complete will depend on the supplies that come through, but we're on track right now to meet all of the targets that we have set. Gordon Cree from STV.
Thank you, First Minister. On the issue of vaccinations, the numbers you've given today about percentages of particular age groups that have been done will be welcomed by people, but inevitably nothing is perfect. And we have been hearing from some people in those age groups, people in their 80s, who say they've not had a letter or a call that appear to have slipped through the net. What do you say to people who are in that situation? And more widely, is it problematic that different areas appear to be using different ways of inviting people for the vaccinations? You've talked before about vaccination letters going out. We've heard of people in some areas, such as Tayside, who've been getting a call from their GP surgery asking if they can come down in the next few hours, and if they can't and they want to reschedule, which, well, we don't know when our next batch of vaccines are coming in. So they obviously have not met that target of being invited for the vaccine by the deadline of the end of last week in a way that is suitable to them. So what would you say to people in that situation too?
Okay, I mean, firstly, nothing in this life is perfect, and nothing in dealing with a global pandemic is perfect. I will readily concede that, but this vaccination programme is going exceptionally well, and I think the numbers speak for themselves, and that's not down to me or government ministers, that's down to lots and lots of people working really hard across the country, planning, distributing and delivering the vaccines into people's arms. And it is also down to the willingness of people in the priority groups to come forward in such huge numbers. So, you know, after a year in which we've not had much to feel positive and optimistic about, let's just allow ourselves to recognise that this is a monumental logistical exercise and a monumental logistical achievement so far. That said, there's still a long way to go. In terms of by I think the end of this week, all mainland boards will be operating in what's called the Service Now platform, which is where invitations are issued centrally. So some people in boards that are already using that service will know that from the blue envelopes that they've been getting. That said, there will be GP practices and health boards that do try to, if they have the ability to do it, to give extra appointments at short notice, because we're trying to get through this as quickly as possible. And there will continue to be a number of different ways used by health boards to get people into vaccination centres or GP practices and with the vaccine in their arms as quickly as possible. And I think with an exercise this massive in scale, I think that is appropriate to do. In terms of if you are in the over 70 group and you've not yet received your vaccine appointment, I want to give some very clear guidance to people. The helpline, which I've given the number of before, 0800 030 8013. If you phone that, if your vaccine appointment was due to be issued centrally through the Service Now system, the staff will look into that. If you have an appointment and it's just that your letter hasn't turned up, they will confirm the appointment to you, or they will reschedule it if it was missed. If you have no appointment scheduled, they'll take your details and they'll pass them on for investigation, and you'll be contacted with an appointment. If you are in a board area where local arrangements are in place, the staff on the helpline will direct you to the appropriate contact within the health board area you live in. And as I said, by the end of this week, we anticipate all mainland boards will be using the Service Now platform. I said last week, and many people have taken me up on it, if you find that you still don't get the answer to your question, you can email me. Don't do that if you can find it in another way, because obviously we get lots and lots of emails, but please use the email address firstminister.gov@gov.scot, not my constituency office, if you don't mind. So these are, in any big system, there will be people that for one reason or another, I have had cases emailed to me last week where it was simply the case that somebody had moved house and hadn't registered with a new GP. There'll be a multitude of situations where individuals perhaps haven't got their appointment. That is not indicative of the system not working well. It's just in the nature of an exercise as big in scale as this one. But nobody is going to be left behind. This is a vaccination programme that is going to reach the entirety of the adult population, starting, of course, with those that are most vulnerable and making excellent progress in the groups that are most vulnerable.
I think just to support what the First Minister said, I mean, often the GP practices, but also the vaccination centres, particularly the local ones, will run with a reserve list. So it may well be that people are phoned to see if they can come in so that they can get their vaccine and stop wastage, but also it means that their appointment's being brought forward. So I don't think the phoning, can you come in with a few hours, is in any way a substitute for an actual appointment. It's the reserve list that people run down. Sometimes people don't turn up at vaccination centres, sometimes there is a slight amount of vaccine left over, and then either the GP practice or the vaccination centre would go down the list of people who would typically be next in line to be vaccinated.
Stephen Gordon from BBC.
Thank you, First Minister. People will have heard a lot over the weekend about the effectiveness of the Oxford vaccine. I just wonder how concerned people should be, how many cases of the South African variant there are in Scotland. And just on the vaccination figures, that figure you quoted for Sunday was a bit lower than the days that had gone before. I just wonder why that is and whether you're expecting an uptick again today.
I'll take that part of the question first. So the Sunday figure is lower than Saturday's, but it's 3 times what the Sunday figure was last week. And we are working to ensure that boards on Sundays are booking up to their maximum capacity. So I want to see that figure increase in the weeks ahead for Sundays, but I don't think we can take anything away from the significant acceleration of pace and progress that we've seen over the course of the week. In terms of the AstraZeneca vaccine, people should have confidence in the vaccine, and I think the numbers of people coming forward suggest that people do. In terms of the South African variant, right now, although we will get more up-to-date information from Public Health Scotland this week, but right now there are 5 confirmed and 1 probable case of the South African variant that have been identified in Scotland. All of them have associations to travel. That's important because it means that while we monitor this carefully, right now we have no evidence of community transmission in Scotland of the South African variant, and that is important. In terms of the trial that was reported, the South African trial of the AstraZeneca vaccine that was reported over the weekend, it's a small trial. I think there were just over 2,000 participants in it. The early data showed limited efficacy against mild to moderate disease due to the South African variant, but it hasn't yet been possible to properly ascertain the effect against severe disease and hospitalisation. The subjects in the trial, as I understand it, were predominantly young, healthy adults, but it is still believed that the vaccine could protect against severe disease of that new variant. Oxford scientists have a number of trials ongoing, and of course AstraZeneca is also working on an amended vaccine to be more active against the South African variant. But let me, as a final point here, stress that the vast majority of virus circulating in the UK is what's called the B117 variant, the one that was identified just before Christmas. And the AstraZeneca vaccine appears to have similar, in other words, good efficacy against that strain compared to previous strains. So people should continue to be vaccinated with AstraZeneca with confidence. And that is a very strong message I think we want to communicate to the public.
And I'm very happy to be immunised by either Pfizer or AstraZeneca when my time comes to be called. Similar to what happened in Germany with the South African trials, they didn't look at older people, so they're not saying it didn't work, they're saying they didn't look at what's happening with older people with the AstraZeneca vaccine. And people's immune systems are complex. We all have heard of antibodies, and the neutralising antibodies that vaccines elicit and promote the response when people are vaccinated in the AstraZeneca vaccine are very similar to those in vaccines that have shown efficacy against the B1351, the South African variant. So at the moment, in the laboratory at least, the neutralising antibodies are there. They are very similar to what's happening with other vaccines that are demonstrating efficacy against disease, against the South African variant. And there's also scientists that are interested in what's happening with T cells. So part of the immune system are also being grown and in response to the vaccine. So people's individual responses have a wide range. And actually a lot of the vaccine are preventing harm and death. So lack of hospitalisation, lack of death, but still showing some infection in the mild disease. So I don't think this is at the moment any different from any other trial that we've seen before. Clearly, we need to keep watching. We know that mutations happen. We need to keep watching. We need to keep observing. But at the moment, I have every confidence, and I would be very happy for any of my family or myself to be vaccinated with either vaccine.
Peter McMahon from ITV Border.
Thank you, First Minister. Good afternoon. First Minister, testing has now begun in Stranraer, which, as you know, has been something of a COVID hotspot. There are still questions there, though, as to why it's taken so long for this asymmetric testing people that don't have symptoms to be set up when other areas, for example, Canonby and Lockerbie, had testing much earlier. Why is that?
Of the local teams that are dealing with this. Asymptomatic testing, not asymmetric testing, is a key tool as we go further into this to make sure that we are capturing cases. We piloted some initiatives before Christmas and we're rolling that out to more communities. Case rates, I don't have the latest case rates in front of me now for different parts of the country, but I know case rates have been falling in Stranraer as they have been in other parts of Scotland, but this approach to testing will help to ensure that we drive cases as low as possible, because they'll pick up examples or people with the virus and get them into isolation more quickly. But the ways in which these outbreaks are dealt with is very much based on the guidance and the decision making of local health protection teams. Gleg Fluker from Kingdom.
Good afternoon. With regards to the rollout of asymptomatic testing here in Fife, can you explain what the rationale for the location of these test centres will be? And given the fact that a lot of people are actually kind of working from home and don't have many reasons to leave the house, who do you expect to make use of these facilities, and in what circumstances would you encourage them to take a test?
Getting tested is one of the legitimate reasons for leaving home. There are not many legitimate reasons at the moment for leaving home, but that is one of them. The locations for the asymptomatic testing initiatives have been identified by local councils and by local health boards. Proposals have been put to the Scottish Government, so the local agencies will have taken account of population concentrations, traffic and travel flows, in order to decide where they think is going to be most appropriate. And of course they will communicate locally the populations that they are asking to come forward for testing. Do you want to say more about that?
And testing, of course, is just one of the layers in our armoury against the COVID-19. The best way is to follow the regulations, you stay at home, wear a face covering, wash your hands, keep social distancing, and that is an over and above. So many people are worried that they may have COVID, they may not have symptoms. For these people, then they would be encouraged to go. I think in other areas, again, the local health protection teams would guide if they're seeing a high level of transmission, perhaps in one community, they would then have local communications to encourage people within that area to go and be tested.
Neil Pooran from PA.
Thanks, First Minister. On vaccine passports for international travel, Nadeem Zahawi seems to have ruled this out. He says they would be discriminatory because we're not mandating people to get the vaccine at the minute. Is this your view? Do you think that's the right approach? And sort of more broadly, looking a bit further ahead in the future, what do you think the impact on Scotland's economy will be, given that we're likely to see restrictions on international travel of some sort for quite a while?
I've already set out my view in Parliament, I think on a couple of occasions, on the concept of vaccine passports. I'm not sure it would be right to rule them out forever, but certainly I think it is premature to be thinking about them as a concept right now, given some of the uncertainties that we still have around the vaccine, its impact on transmission, for example. And as I've also said in Parliament, there are ethical questions as well about the fairness, what they signify, you know, whether it would be discriminatory to some groups. So I think there are big questions that have got to be thought through before you could get to a position. And I think we've got to know and understand more about the vaccine. Does that mean never, ever, ever? I don't think it would be right to say that right now, but I don't think it is something that is likely to become feasible or desirable in the immediate future. You know, the reason I wouldn't say never, ever, ever is because we know there are some diseases already where in order to travel to certain countries you have to have proof of vaccination. So as a concept, it's not brand new, it's not unheard of. But as I say, I think there's lots of understanding that has yet to develop about the vaccine, and there's lots of issues that I think have to be thought through before we were in a position of really looking seriously at that. On the economy, you know, there's going to be an impact on our economy from COVID for some time yet. That is why it is incumbent on all governments to continue to make sure there is support available. The job retention scheme, targeted support for industries that are most affected. Airports, aviation are going to be affected, I think, for some time, and I've spoken previously about wanting to work with the UK government to make sure there is appropriate support in place. But if we can get ourselves to a position through a combination of suppression, elimination, keeping virus levels very low on the one hand and vaccinating more and more people on the other, if we can then open up some greater domestic normality within our own borders, then that will be good for the economy. You know, it'll be good for domestic tourism, it will be good for other sectors of the economy that have been really hard hit. But the price we may have to pay for that for a period of time is not having travel into and out of the country from elsewhere. This is going to be, as it always has been, but it's going to be even more essential for me to set this out clearly to people in the weeks and months to come. There's going to be trade-offs here. We won't be able to do everything for some time yet, so we will have to choose. What is it that's most important to us? I've always put children's education at the top of that category, so what's most important to us, and what of the other choices that we might have to make helps the economy more. So these are going to be difficult decisions for us in the weeks to come, but I will, as I've always tried to do, set them out as clearly as I possibly can. Christine Lavelle from The Sun.
Thank you, First Minister. We've reported today on a former nurse whose breast cancer spread to her brain after she faced a 7-month delay for treatment during the first lockdown. The charity Cancer Support Scotland have also warned that they're now seeing patients who were diagnosed late as a result of the pandemic. How worried are you about the decisions that were made last year to pause screenings and put off some treatments? And what would you say to patients who feel this led to the COVID crisis being prioritised at the expense of other life-threatening conditions?
Firstly, obviously I'm not going to comment on individual cases except to say that my heart goes out to anybody who is in the position of the individual that you've just talked about there, and you know, my thoughts are with her and with anybody in a particular in a similar position. How worried am I? I think for the rest of my days I will worry about and agonise over, and like many people be haunted by the choices that we've had to make over these unprecedented times that we're living in. These weren't choices any of us wanted to make. I never wanted to be in that position and hope we never have to be in that position again, but these choices have been essential. We have sought throughout the pandemic to prioritise urgent care in the health service, and that very much includes cancer treatment. And as we go through the pandemic, we try to get more of the non-COVID care back to normal within the National Health Service. I never want to have a situation where we have a national COVID service and not a national health service. And that's one of the reasons why we've had to and continue to live under these lockdown restrictions, because the more we can suppress and keep the virus to the lowest possible levels, the less COVID pressure we put on our National Health Service and the less interruption and disruption to other services we have to contemplate. So these are horrendous decisions, but for those who've had delays in treatment over the past year, we can only imagine the trauma and the stress and the anxiety of that. And the focus of the government and the health service is to have as much treatment operating as normally as we possibly can. I'll ask the Chief Nursing Officer if she wants to say a bit more.
And like the First Minister, it's deeply distressing to hear of these delays and the negative impact that it's had on people, and I am incredibly sorry that has happened. There were, at the beginning of the pandemic, there was broad clinical consensus about stopping some forms of chemotherapy and some forms of treatment because it wasn't known that the impact that COVID would have on people who were undergoing these treatments. And similarly, evidence has shown us that people who do catch COVID, and if they're having surgical interventions, they do not do nearly as well as if they don't have COVID. So there has been clinical consensus about some treatments not being available. There has also been clinical consensus about the ability to have what we call green or COVID light centres. So as we've gone through the pandemic, we've then learned more about it, about what treatments can be offered, and it's more than we originally thought. But that was a clinical consensus that stopped the treatments. And now as we're looking at the evidence and the research, then we're able to offer that with more confidence. And similarly, making sure that we have appropriate infection prevention control pathways, so the red and the green pathways, so that people who do come forwards and need that urgent care will be treated. And increasingly, that's where our focus is, and the Cabinet Secretary for Health has talked about remobilisation of the NHS. That does, of course, mean that some people who have maybe causing a lot, I'm thinking of joint replacements, can cause quite a lot of discomfort, but not life-threatening, will inevitably have to wait slightly longer so that we can absolutely prioritise those urgent cases and care that we need to deliver as we move forwards.
Gina Davison from the Scotsman. Is Gina Davison there? Maybe move on and come back to Gina in a moment. Rachel Watson from the Mail.
Thank you, First Minister. I just wanted to follow up on comments that Jason Leach made this morning. He was talking about the GCVI group and the fact that they're considering looking at prioritising occupation for vaccines after the over 50s are finished. Is that something that you support? Would you like to see that? And what kind of professions would or could that include? Would it be teachers, supermarkets, police, etc.?
I think you'd have to ask the GCVI that. I place a lot of store, as we have always done, on GCVI advice. They are considering, as I understand it, if there should be further prioritisation of the rest of the adult population once we get to having done everybody over 50, but we haven't had that advice yet, and I think it's probably better to let them come forward with that if they choose to do that in due course. I'll try Gina Davison again. Nope. Tom Martin from the Express.
Hi, thank you, First Minister. A couple of things, if I may. Just on the Sunday figures, when do you expect to see them sort of hitting the kind of levels we're now seeing on a Saturday? And what sort of specific measures are underway to sort of get things running full steam across the full 7 days? And just on test positivity, obviously now we've had a couple of days where it's crept back above 6 after, hitting that benchmark of below 5 last week. Is that sort of small ray of sunshine that you talked about last week sort of heading back behind the clouds again?
No, it's not. I mean, I said last week I knew that I was probably making trouble for myself in commenting on a single day's figure, but I just thought it was good to give people a sense of hope. But as I said last week, we can't look at single days figures. They fluctuate. So that's why you often hear us talk about the 7-day rolling average. And we are seeing test positivity come down, just as we're seeing case rates come down, but we are going to see it fluctuate on a daily basis. So it doesn't mean the ray of sunshine has gone behind the cloud, but it still means that these rays of sunshine are just that. They are rays of sunshine, at the moment. Cases are still too high, so they are lower than they were at the early part of the new year, but case numbers are still higher than they were the week before Christmas. So we are not out of the woods on this right now, which is why the stay-at-home message remains so important as we continue to vaccinate more. And the vaccination programme, to go to the first part of your question, is powering on all steam. And the Sunday figure, much higher than it was last Sunday. This is just about health boards making sure they're booking their capacity on a Sunday. And I would expect to see that continue to increase in the weeks to come. But I don't want to take anything away standing here today from the monumental efforts and achievements of the vaccination teams over the past week. I think every day last week up to and including Saturday, we vaccinated at a proportionately higher rate than in England. And because there had been concerns, I'm only mentioning that because there had been concerns about the relative pace of the programme. We focused deliberately on maximising uptake in the most vulnerable groups and then said we would accelerate pace after that, and that's exactly what has happened. And I would expect that pace to continue to be a fast one over the course of this week, as we will undoubtedly pass the quite important milestone of 1 million people in the country of having had the first dose of the vaccine.
And I think as we move forward, boards have been planning for this for some time, but what boards didn't know was uptake, vaccine supply, availability of premises, how easy it was to get to premises, and we've got our super big vaccine centres, but we've also got our small community halls that a lot of local people enjoy going to and find that more convenient. And as we're moving forwards, the government's just released funding for an additional 500 staff to make sure that this then becomes business as usual and mainstreaming that into day-to-day business as we move forwards. So at the moment, there's been additional staff, there's been staff pulled in to do extra, and we're incredibly grateful to them. But as we move through this programme, it will become more business as usual, and we'll be able to get into a rhythm of what suits where we're delivering the vaccines, and also what suits staff, and what most importantly suits people who are being vaccinated.
Adele Merson from the P&J.
Thank you, First Minister. We've spoken with one mum in the North East who's calling for dedicated long COVID-19 clinics to be set up to help people like her 8-year-old daughter, who is still sick with symptoms after catching the virus in April. She thinks that GPs and hospitals do not necessarily have the time or resources to spend on this. Is it something the Scottish Government is actively considering, and do clinicians expect significant pressure in the months to come from those suffering long COVID symptoms?
Long COVID is certainly an issue the Chief Nursing Officer might want to say a word as well, of significant concern. It's one of the reasons why we can't be complacent against this virus, even as hopefully vaccine starts to reduce serious acute illness and death numbers. In the younger population, there is still this seemingly quite significant risk of long COVID. So it's something we are taking seriously and treat very seriously. We've set out before that we have funded a number of research projects into the characteristics of long COVID, some of the conditions that people go on to experience. That research is really important before we can really work out, or before clinicians can work out exactly what specialisms you would need to have in more specialist centres of provision. So that's something that, yes, we may well get to in the future, or it may be that we think with the right resources, long COVID can be catered for amongst GPs and existing health provision. But understanding it, right now there is not sufficient understanding, because it hasn't been around for long enough, of exactly what the impact of long COVID is, and therefore what specialisms are needed to properly treat it. And that's why that research is so important.
And I understand from listening to people how distressing long COVID can be, and the anxiety that brings, and therefore whilst I don't know, but I can only empathise with that mum and that young person and people around the country who have long COVID, and that lack of information. So if you have another disease, you can ask your practitioner, you can go onto NHS Inform and find quite a lot and lengthy information about that disease. For long COVID, there's not as much. And I'm no way diminishing the severity of how people feel, but to be encouraging to people, most people with long COVID do recover. What we're very clear about also is that we want to be able to support people to navigate their way through services. So across the UK, we have the people will perhaps be familiar with NICE, which is an English guidance, and in Scotland we have our SIGN equivalent, which is best practice, and what we have here is an ongoing guidance across the 4 countries to give practitioners, doctors, nurses, other healthcare providers access to the best possible advice on how we support people with long COVID. And were it as simple as having a long COVID clinic, then that in a way would be easy. However, what we're saying is that the general practitioner should be that navigator through services, because for some people it may be a depression, for some people it may be problems with kidneys or heart or joint pain, and therefore all of our specialists are involved in supporting people with long COVID, and it certainly is something that is up front and central in our thoughts when we're thinking through how we plan to remobilise our NHS. And this is clearly new and novel, and it's going to be there for us to help navigate people through our system so they get the best possible care they can.
Helen Ricardo from the Herald.
Afternoon, First Minister. I just wondered whether or not the Scottish Government has any data on how many of the over 80s or versus who are housebound have been done. I've spoken today to someone who's 97-year-old mother, still hadn't heard anything, and I'm also aware of cases of a 102-year-old, a 95-year-old, and an 84-year-old with COPD and heart failure. None of them have heard anything yet. So I just wondered whether or not the Scottish Government had any specific data on housebound figures, and also just in relation to, you mentioned the 99.5% figure for the older care homes. I also wondered whether or not you had any figures in relation to the non-elderly care homes. So, for example, people who are learning disabled. Do we know what proportion of them have been vaccinated yet?
So it's actually 99.6% of residents in older adult care homes and 93.3% of residents in all care homes. So those are the up-to-date figures. I certainly don't have data in front of me for the numbers of, and it will be very small numbers, although for anybody in this category, of course, it will be a big thing, but there'll be small numbers of older people who are housebound that health boards are still working through. I know a lot of them have been done already, but I don't have data. I'll check whether we have any. I certainly don't have it here with me. But let me stress to people or to family members of anybody in the age groups that should have either been vaccinated or had the letter right now, if you haven't heard, then please phone the helpline. I'm not going to go through exactly what the helpline will do. I did that earlier on, but I'll give the number again, 0800 030 8013. And your details will be taken and the helpline will investigate that and get back to you, or if you're in a health board that is not using the centralised system, we'll pass you on to the appropriate contact in your health board. And of course, if all else fails, you are still welcome to email me and I will make sure that your situation is looked into. Mark McLaughlin from the Times.
Afternoon, First Minister. The weekend, Ursula von der Leyen described the EU as a slow tanker compared to the UK.
Sorry, I'm not hearing you, Mark.
Can you hear me now?
Yep.
At the weekend, Ursula von der Leyen described the UK as a speedboat when it came to the vaccine, and the EU is like a slow supertanker. Now, you probably recognise this rhetoric because it's what you and your ministers have always said about an independent Scotland, except in your iteration, Scotland's the speedboat and the UK is the slow supertanker. Now, given that coronavirus is here to stay, there's going to be future pandemics. In a race, why would you want to jump out of the speedboat to hitch a lift with a slow supertanker? Has this whole sorry saga with the EU and the Ireland border dented your confidence in Scotland and Europe prospectus? And more importantly, do you think it's dented voters' confidence as we come to the election in May?
You've kind of slightly lost me, Mark, in all your different boats. I didn't hear the comments of Ursula von der Leyen at the weekend, so I'm not able to comment on them. Look, I'm just focused on getting people in Scotland vaccinated as quickly as possible. We don't know yet how often this vaccine might be necessary. I certainly would work on the basis that it is not a one-off. I certainly hope in our lifetimes we don't have another pandemic, but we can't be certain about that. But look, I'm focused on getting us through this as safely and as quickly as possible and getting people vaccinated here as fast as I possibly can. So that's my focus every single day right now, and I'll leave discussions about different types of boats, if you don't mind, to another day. Dan Sanderson from the Telegraph, sorry.
Thanks very much, First Minister. Just on the plans for the managed quarantine system, I just wondered if the Scottish Government had done any work on how many sort of international travellers you're expecting to arrive into the country next week who might have to quarantine. And also just on that, I know you've said it's your preference to persuade the UK government to go along with you and impose a blanket system across the UK. I think it's probably fair to say that looks unlikely now, given there's only a couple of days to go. So can you confirm that there will be a blanket system in place in Scotland from the 15th of February? Thanks.
Michael Matheson will be making a statement to Parliament, I think, tomorrow, where he'll set out the update on these provisions. We intend to have a comprehensive system of managed quarantine. We think that is essential to minimise the risks of importing new variants. But in terms of an update on the procurement work that's going on around that and the timetable for introduction of that, Michael will give an update tomorrow. And Chris McCall from the Daily Record.
Thank you, First Minister. A couple of brief questions, if I may. Firstly, Jason Leitch said this morning it could be some time yet before supporters are allowed back in sports grounds. Should fans accept this basically means they're unlikely to return before the football season concludes in May? And secondly, were you disappointed by the Scottish rugby players who failed to take a knee at Twickenham on Saturday?
I think the SRU have given some explanation around that. I have no doubt that everybody in the Scottish rugby squad is absolutely firm in their opposition to and complete condemnation of racism in all its forms. And since you've given me the opportunity, let me take the opportunity with both hands to congratulate the Scottish rugby team on a spectacular and historic victory at Twickenham on Saturday. And in relation to the first part of your question, I don't know is the honest answer to whether football fans or sports fans more generally might be back in stadiums before the end of the football season. I would like to hope so, but I can't be certain about that. And I'm not going to try to give people an answer about something that involves me looking much further ahead than it's possible to do right now. I will continue to set out, when we know things, our best estimate of when things will get back to normal. But for now, it's really vital that everybody sticks to the restrictions in place. That's the way to suppress this virus while we continue to get through the vaccination programme. Now, I'm going to give one last chance to Gina Davidson. I don't think she is there. So that completes the questions today. Thanks to all the journalists. Thanks to Jill for our interpretation, and to Fiona for helping me with the questions. I'll be back here, I think, with Jason Leitch tomorrow, so he can answer for his own comments rather than have me do it all of the time at 12:15. But in the meantime, please stick to the stay-at-home requirement. It is working. I know how tough it is, but it is working right now to get the virus back under control while we continue to vaccinate more and more people. So my thanks to everybody for that, and I'll see you at the same time and same place tomorrow.